because we only have data on adolescents. We don't have data on the 18 to 26-year-olds that this actual project is looking at. And so when I first started looking at it, and of course the introduction of the HPV vaccine, nationwide it has been a slow uptake of this particular vaccine in comparison with other vaccines like Tdap or meningococcal vaccine. And so it was definitely a concern for CDC, but also a concern for us here in Hawaii. I just got back some, looking at some data. We're above the national average, but we're still below 80%. We're around 70% with our adolescents. And so we really want, in order to ensure protective value and also ensure that disease outcomes will not occur, we really want this rate to be very, very high. And now that it's being introduced into males also, we all know that it doesn't take one, it takes two to tango. We want to make sure that both populations are actually getting vaccinated. And the people that, like Dr. Hernandez, who see the data with the diseases, and also our OBGYNs that see abnormal PAPs and everything like that, we know that it exists and we know there's a problem there. And so the lack of data in this age group and the lack of studies is really important, and that's really where we wanted to try to look at. We do have adolescents, and we're talking about, or talking with pediatricians on how to frame the messaging, because a lot of times it's always about, okay, it's a sexual question instead of a cancer question, right, or a cancer way of looking at it. And so we really need to arm our physicians with the right tools to be able to communicate to parents and be able to not give it as an option, but more as a recommendation. And we know that if physicians recommend, majority of the time, most parents or people will accept the vaccinations. And so we really want to try to work on that and just get a better understanding.
Thank you. Thank you. And so the study has several major aims and activities. So one is just to get some baseline information about HPV. What do college students on both campuses, Manoa and Hilo, what do they understand in general about HPV, and then about the HPV vaccination? What are some of their attitudes? We want to know in the survey, I'm talking about the online survey, but in the survey we're also asking some questions. Have you ever had at least one dose of the HPV vaccine? Just so that we can kind of get it's you know, from the research term, it's a convenient sample, but we're just to get some information of, say we have 300 students, you know, X% of them had never heard of a vaccine, X% of them had 1 or 2 doses, you know, X% actually completed it. So that'll give us some useful baseline information. But we're also asking some questions about information sources. So how, you know, what's important to you to make a decision about getting a vaccination? Just so that, again, we have an idea how a college-age population would view those kinds of information sources. And also influences on decision-making and some other things. But those are the main parts of the online survey. And that survey will actually go out to, oh good, you have your hand out. So thank you so much. But that survey will actually go out to be distributed widely to UH Hilo and UH Manoa students. We'll be distributing that through the various classes. And then it'll be, you know, optional and voluntary to participate in that survey. We're also going to be getting some other baseline information from the student health services, both at UH Manoa and UH Hilo. Just to see what kind of, what % of their population seen over 3 years is has received any dose of the HPV vaccine, some other things. So that's kind of the baseline data piece. And then the other piece, which is actually the main piece and why we have so many student leaders involved, is really this the development and implementation of a peer-designed and peer-led outreach. Our thought is that if we have students who are in college and graduate school level, that you may know better than me, who's been out of school for a really long time, that you folks might have a better idea of how to reach your peers. And with the new evolving technology and social media and other things, That's why we've asked Bert to help us, because a lot of many things in health are really moving towards this concept of mHealth, or the use of mobile technologies or social media or other things. And so we wanted to make sure that we had an expert available to help guide us and to actually teach the students a little bit about some opportunities to consider as they design the project. Okay, so, and so the student leaders, that's kind of one of the main roles ultimately of the student leaders, and we'll go a little bit more into schedules and stuff later. But then the other thing, and why we have pharmacy and nursing and public health and medical folks, as well as undergraduates and graduate students working together, is because of this concept of interprofessional training. Pharmacy students know, you folks are involved with interdisciplinary training within your sites, and some of you rotate in Hilo with the family medicine clinics, and rotate in Milani, hopefully soon again, with our clinic and our family medicine residents and medical students. But that's really, for healthcare, that's really the way that it's going, is this interdisciplinary team. And so, the process of the engagement of the student leaders and others, we're also going to be kind of looking at and asking some questions at the end, just kind of what are your thoughts about this interdisciplinary kind of planning and implementation and evaluation approach, just again to kind of see, and because there hasn't been a lot of information about that in a broad setting like this. There's a lot of literature on how teams work in the hospitals, in very specific clinical settings, geriatrics, fall prevention, but not so much in a process like this. So, we're just kind of interested in seeing and hoping that we'll, think this is great at the end and have some great results and then kind of move forward. So that's kind of the general purpose. Any questions at this point?
Yeah, just one clarification to clarify in my mind.
Sure.
The target population really is college-age students in college, right? It's not...
And the main is females in college.
In college. It's not college-age students who aren't in college. It's not, so who aren't...
Correct. For this study, it's college-age Filipina women, age 18 to 26. Filipino Pacific Islander, sorry, yeah. But in college. Okay. And so you guys have the handouts in front of you. So, so I just wanted to go over just a little bit about, and I went over a fair amount of details, but just the other thing that you have in your packet is, I know you can't see it, so one pager, it has a table and it looks somewhat like a calendar. I mean, it has some details about the training sessions, and it basically, this is kind of our estimate of the time commitment broken out by different activities. So we'll go through that, but I just wanted to call your attention to it. And then there's a calendar on here, because many of us, sometimes it's hard to see things in this format, so like the calendar is easier to look at. And then we have a kind of a list of potential student leaders. So that's kind of what's in the packet. And so, the part of this project, this is actually a community-based participatory research project, and I'm going to ask Angela to spend a little bit of time, and then maybe if Neil wants to supplement after Angela, but kind of what is CVPR, why we wanted to kind of employ this model for the project. So Angela, just...
Yeah, so community-based participatory research, that's actually a type of research that's used in health, public health research, health promotion research, maybe even clinical research now. So that term, community-based participatory research, often it's called CVPR. Sometimes you'll hear people call it community-engaged research. So there's a few variations on the term. But the general definition is that the research is conducted with and in partnership with the community, however you want to define the community. So in this case, our community is actually UH female college students, and primarily with a larger representation of Filipinas and Pacific Islander females. So that's our community. As opposed to something like community-placed research or research in the community, this is research with the community. So we're not doing research on the community, but we have the community and representatives of the community work equally with we call it the academic research team. So those are usually the traditional researchers, but us as traditional researchers realize that folks who are from the community also have tons of knowledge on what goes on, what works, things like that. So hopefully, so this model, by partnering academic and the community, will make the research more effective, will help us find answers. Lee mentioned health disparities, will help us find answers to why maybe there's, unequal rates of disease, for example. In this case, the unequal rates is both generally the college population might have lower HPV vaccination, but then Filipino women and Pacific Islander women also have higher rates of cervical cancer. So perhaps that's related to their vaccination behavior. So that's community-based participatory research. So we are working equally in conjunction, and so we work with the community, again, you as students and mostly female students, to help us design the project. So we mentioned social media. From our research standpoint, we know that social media is an emerging area in all areas of health, including HPV vaccination promotion, but sometimes like smoking cessation, things like that. But we know that younger generations use social media, so you guys should be able to advise us on how you like the social media to be used, whether it's text messages or Facebook or something else that I'm not even aware of. But not only how, but what kinds of messages, right? So in health education, you usually have two components. You have the medium of delivery. In this case, we're thinking in social media, but then you have the content. So we also need you to help advise on what kind of messages will be effective for folks like you. So that's the community partnered approach, community engaged research.
Thank you.
So thank you very much for participating, Rashi. It's always very exciting working, with folks, in this way, because personally, I always learn so much too.
You want to say anything?
Just a couple of things. So one of the ways that I remember what community-based participatory research is about is the other model is a top-down model. So before, a lot of times, physicians and researchers of all types felt that they knew the answers to everything. So they would drive the research from the we know best from the top, and then use the community research on it and get nowhere with it. And especially things like, so they have a vaccine now, but for some reason it's not reaching everybody. And so the scientists don't have the answers to that, the community has the answers to that. And so that's why you need the community's know-how, contacts and so forth, to be able to decipher all that and reach each other. So in fact, it becomes the community is at the center, not at the institution, not the researcher. And that is the difference, and that is, especially in disparities research, a very important thing is where the community becomes an equal participant in research. You're not second, you're not third, you're actually anything on top of everything. So that's an important piece to think about, and it puts many of you at the center of it, as opposed to, again, the John Burns School of Medicine or the School of Pharmacy or any of it. We facilitate.
Angie, do you want to say anything?
Actually, I had a question.
Sure.
So, are we limited to the four-year universities, or are we looking at the community colleges?
Okay, so that's a good question. Because of the limited funding on this, we're just limiting it this time for this project just to Manoa and Hilo. Hopefully, so this is really viewed as a pilot. And what we're hoping is that if it is successful, we'd be able to expand and replicate and actually, adapt further to the community college setting, because, and why that's also important is because some of the populations that may be harder to reach actually are going to school at the community colleges and may not be in the four-year universities. But for this project with the very limited time frame and scope, we have to limit it to Manoa and Hilo. Any questions from you folks in Hilo? No? Sound okay so far? No? Okay. Okay, good. So thank you, Angela, for that. And we'll talk a little bit more about the other roles of the advisory board towards the end, because it's not just with the design, but there's also many other roles. Again, it's kind of, you guys are doing the research. I already spoke a little bit about health disparities, so I'm not going to go more into that, but if I could ask Brenda just to give just a quick overview on HPV and the relationship and vaccine and why this is so important.
So we've done HPV research in the community for some time now in terms of looking at the epidemiology of HPV. So who's infected and when they're infected, how long the infection lasts. Because we know that people who are at most risk for developing cervical cancer, as well as other HPV-associated cancers, are those that develop long-term persistent infections. So one of the largest studies that we've done included thousands of women here in Hawaii, and a lot of the women came from UH Manoa. In fact, one of our study sites was out of the UH Health Services. And what we found in that study was that about 20% of all women, adult women, so these are 18 and over, have HPV infection at any given time. However, most of those infections were transient, meaning that if you measured them again a couple of months later, a lot of them would have no infection, no trace of infection. So we're trying to look at what were the factors that were contributing to persistent infections. So we do know that since then we've actually looked at HPV in men as well, and know that at least a quarter of men or more have HPV as well. And our transmission studies have shown that HPV is readily transmitted between males and females through sexual contact. And we've been really trying to look at different factors that are driving the natural history of HPV. But we know from our research and research that has been done nationally and internationally that this vaccine is very, very effective in preventing HPV infection and subsequent cancers associated with. In fact, a study that just came out recently has shown that this is a national study done through the NHANES system, and has found that of those population of girls vaccinated with HPV, the HPV vaccine, they're already seeing a dramatic decrease in the prevalence of HPV. So we know that on a population basis, it's a very effective vaccine. But as others have said, the problem is that not enough women are getting it. And the gap age of the reason we're targeting this group is because it's this age group, the college age women, that are at most at risk of not getting vaccinated. Because you're out of the school system, you're not getting your annual physicals to go back to school, and so a lot of them don't have access to primary care, or not readily accessing it. And so that's one of the reasons that we suspect that a lot of women in this age group are not getting vaccinated. In addition to cervical cancer, it's important to know that HPV is associated with a host of other cancers, and including in women cancers of the vagina and vulva, as well as cancers of the mouth or in the oropharynx, as well as cancers of the anus. And anal cancers, in fact, are increasing steadily in the United States as well as worldwide, and the increase is seen in both men and women, but the increase has been slightly more in women than in men. And we suspect that it is HPV related, but we're not really sure. So HPV, if the vaccine is available and utilized by populations as it should be, has a potential to really reduce a lot of different cancers, including cervical cancer.
Ron already kind of spoke a little bit about why we want to work together and why it's important. And the other reason why it's important to have both Ron and Maricel here is, they're kind of the experts in immunization and the data and in the programmatic and the public health point of view. And so we want to make sure that we're all saying the same thing, that we're all correct and be uniform. How we deliver the message may differ depending on who the population is. We want to make sure that we're working together with the Department of Health and following, what national recommendations are, et cetera, et cetera. But we also have besides the education and the design and the outreach component, we actually are hoping to give some vaccines. And so, we've partnered with the College of Pharmacy because of some of the curriculum that they already have in vaccine administration. So if Carolyn, you want to just speak briefly to that?
So, our students, as you know, it's a 4-year curriculum for a doctorate of pharmacy. And our students and across the country, pharmacists have been taking a more active role in immunizations and in other vaccinations. You can see all the retail stores now do that, which is sort of a takeoff. Most pharmacists went into the profession because it was sort of a hands-off. So we actually mandated this back in 2008 with our inaugural class. So they usually get trained in the beginning of their second year. And then from there on, they, are able to do flu vaccines and any other vaccinations that they encounter in any of their experiential rotations. And then also we hold health fairs also. So this year we'll move that actually to the end of their first year. So when they go out in their first retail rotation in the summer, they'll be able to do that as well. So, our interest, obviously, because I'm an oncology specialist and we have this capability, is the more vaccinations that our students do, the more comfortable they're doing it, and it certainly is a service to the community. And also we wanted to get more involved with the Student Health Center. And we now have pharmacy students down at the Hilo Student Health Center working down there as well to dispense a lot of their medications for the student body. So we're hoping that we can set up some health fair days on both campuses. We can have any number of our pharmacy students on the Hilo campus to help with that, and then we have students also on island here on Oahu that could go up to the UH Manoa facility to do those immunizations as well. So, and we haven't talked about this. We might have the capability to train others if they wanted to do that. We have a training from the American Hawaii Pharmacists Association in April. So depending upon the time frame and everything, we could recruit other students to do that as well if we were to go through a training program, which is usually a day long. So.
Great, thank you. Any questions about that component? So the idea is with these health fairs, they would be multidisciplinary, and the student leaders would be a big part of trying to recruit participants for the health fair. And if you can show up, again, just the timing, but there's a lot of different roles for the student leaders. But the thought is that we'd all be working together and helping provide information and outreach, and then again, for those women that are interested and eligible, actually be administering the vaccination, at least the first dose. The vaccine is the whole series is usually 3 shots, usually administered at time 0 and then 1 month later and 6 months later. The study is slated to end by July, so there's no way we'll get the 3rd dose information. But at least to try to get the first dose. For some women, it may be their opportunity to get caught up and to get their 2nd dose or 3rd dose. And then both student health services do offer the vaccine. And so then the hope is that if they're going to choose to complete the series, that they would get it at student health services, and we'd actually be able to track that, later, even after the study is done. So, so again, not perfect in terms of a perfectly designed study, but I think pretty good for the time frame. And so the big question for all the students' minds is, okay, this sounds awesome. How am I going to fit this in? What's expected of me? And I've got finals. Like, what are you guys thinking? There's midterms and all that. You guys are nuts. So we've put together this 1-pager sheet. And so this is so what's not on this sheet is this meeting. So this is the Community Advisory Board meeting. And we have planned 4 meetings. Usually they will not go more than 2 hours. And we'll try to see if we can get this one to an hour and a half. But that's the Community Advisory Board meeting. So again, we know that maybe not everyone can make every single meeting, but we really hope, because really you folks are going to be helping to guide us and give us feedback. You know, at future community advisory board, being like, this is the introduction meeting, right? But the next one, we're actually going to hear a little bit about what's some of the preliminary findings from the focus groups, and what are some of the preliminary findings from the surveys, and then, you know, how did the student leader sessions go, and then really what are the next steps. So it's really to kind of make sure that the whole community advisory board is really informed, you know, and then the other meetings will also say, okay, well, here, let's look at the data, and is there something different about the analysis? Are there other things that we should consider about how we analyze it or how we present it? You know, again, it's important. It's depending on what comes out. You know, we don't know what the results are going to be, but how the information is disseminated or transmitted to different audiences really does matter. You know, the traditional research way is to finish a research project and write a bunch of articles, and then like who sees those articles, right? But we really want to make sure that the information is used. Trainings listed there on your sheet, and all the trainings will be recorded in case you can't make it. But the first training is really about CVPR and also focus group facilitation training, because we really want the focus groups, which are basically discussion groups. They're kind of guided talk story groups. There's a list of questions and sort of like a script. There's somebody to facilitate the discussion, to make sure that everybody gets a chance to be heard. There'll be note takers, but we really want that to be facilitated by the student leaders. We will make sure that there's other people, observers in the room who have actually a little bit more experience with focus groups, just to kind of, you know, be there in case there's questions or troubleshooting. But we really want the facilitation and the discussion to be by the students. And so that very first training is important. And so if the student leaders cannot make it to that first training, then they won't be able to participate as a focus group facilitator. But they can certainly participate in all the rest of the stuff. Okay? So that was, I know, one question. The next session, and so that is slated. We're running it 2 times because we know that there's a lot of potential conflicts for the Friday session for the Hilo side, and so Angela is gracious enough to do her thing twice. And so the first session is going to be on Friday, February 7th, and then there'll be a repeat session on Tuesday, February 11th. So again, student leaders only have to go to one. And the location of the Tuesday session is still being worked out, so we will, get that information out to you guys as soon as possible. The second section, the following week, will be on health disparities, but each session is, we're not going to spend 2 hours talking about health disparities, right? The educational piece of this, we're trying to keep it to about maybe 45 minutes or an hour, but then incorporate something else, so like a discussion group. And so if you, with the information sheet, there's terms like planning discussion groups with the leaders, and there's all these acronyms, very confusing. But basically, we're going to pair each session with a discussion group with the leaders, and each discussion will kind of build, because that's the time, we want to try to minimize the time that the student leaders have to, gather, because it's so difficult. And so then, at the first session, the focus will be on the focus group training. The second session, we'll talk a little bit about health disparities, get some ideas from the student leaders, why the disparities may exist, what are possible contributors. And that's important information because we're going to be getting the input from the student leaders, and actually that information will help guide future discussions about, well, then how can we reduce those? How can we improve access to this information? How can we better tailor existing information, etc. So that's the second one. The third one, Brenda is going to speak about more in depth about the HPV virus and the vaccine, and the kind of the evidence behind it and stuff, because we want to make sure if you as student leaders are going out and recruiting your folks, we want to make sure you have correct information too, and have the opportunity to answer any questions that you might have. But also, there are materials that the Centers of Disease Control have made for younger adults, as well as a lot towards the 6-year-old, sixth grade, not 6-year-old, the 6th grade population. And so some of those materials that they've had made for the younger women or for the young adult population may not be the most fun or interesting to read, shall we say. And so we really would like input from the student leaders. How do we improve upon this? You know, the information, the content is accurate, but the method and pictures or lack thereof are like, well, kidding? Like I wouldn't read it, okay? So we really need the students to give input and because there are written materials, and so, you know, we want to better utilize those. The 4th session will be on the vaccine administration, and again, open to all of the student leaders, because there may be people that want to, you know, actually help and learn, or maybe interested in going to medical school, pharmacy school, nursing school, all those things. So it's, again, it's not just the pharmacy students for this one. And then the discussion afterwards will give us more of a chance to really look at this, what about this health fair, and how do we, you know, kind of details, and let's really think about this, and how might we best go about implementing. In the meantime, know that we have asked both Manoa and Hilo to let us know what their existing outreach plans are and calendars, and Manoa has a website and a student 101 and videos and different kind of stuff. And so I spoke with their director today and said, you know, we want to make sure that we're on the same page and working together with student health services, and certainly not competing, and we want to help, you know, help augment. So, you know, we'll have all that information as well. And then the last session will be for Bert, with Bert. And so want to just ask you to say a few words, a little bit about how this, some of the work that you've done and how this might relate to this project.
So my role really is to take a look at some of the tools that are out there that we could perhaps use to help both this idea of, you know, kind of getting the message out, there, but what objectives do we want to achieve by getting the message out there? So obviously, you know, we have things like Facebook, Twitter, Instagram, YouTube, you know, the whole gamut of social media. I would consider them like channels. So how do we really kind of engage our community to take a look at some of these channels and look at the messages that we're conveying? It's not only for outreach in terms of a one-way sort of dialogue, it's also a two-way dialogue. So how do we actually have this conversation with the folks that, you know, we're reaching out to? So, you know, there's a lot of tools. It's really the art is how do you bring those tools together, and how do you actually build a campaign leveraging, you know, this whole Web 2.0 capability. So that's what we're kind of, I'm kind of looking to the student leaders to come up with some ideas. I mean, I have some ideas, but, you know, I think together we could come up with, you know, sort of the right mix of what works and maybe what doesn't work.
Great, thank you. And for the focus group, thank you. So that's the kind of the training and the social media and the big picture. The other important piece of information, and the other important way that we're going to get information from the general students are through focus group students. And so the focus groups are basically discussion groups, like I mentioned before. We're actually trying to learn specifically, we want to have focus groups kind of grouped by Filipinos, and then grouped by Pacific Islanders. And if we can, we want to kind of sort it out by I've never had a vaccine, a HPV vaccine, as well as those who might have actually had the vaccine. And then the last set of focus groups is just kind of mixed, college age, separated by vaccine or not vaccine. So there's this whole kind of, on the interest form page, there's a bunch of questions that will help us kind of sort out, you know, who might go to one focus group or the other. But like I was mentioning earlier, the role for the student leaders, we would like the student leaders to facilitate the focus groups. Each focus group should last no more than 1.5 hours. And we, you know, at a minimum, we'd like, you know, one leader to facilitate, we'd like each leader to facilitate one focus group. Now, there may be more leaders than focus groups, and that's fine because not every leader is going to be available on the time of the focus groups. But we'll talk a little bit more at the very end about possible scheduling issues for that. But basically, where we also need your help is recruiting people to these focus groups. And again, it's a discussion. It's a discussion group, and the participants will be guided through some questions just to see what their knowledge is about the HPV virus, and then about the HPV vaccine, kind of fears and thoughts or barriers or influences that might affect their willingness to get the vaccine, and then also about what types of information would be useful for them to make a decision about the vaccine. So the information from the focus groups as well as from the online survey, then the student leaders will use that information to design the project. I spoke a little bit about the online survey. The online survey is actually going to go out widely to everybody. We put 15 to 30 minutes, but it probably would take less than 15 minutes to do the survey. And that'll be distributed through the faculty in various fields. A lot of the pre-health sciences classes and courses, social sciences, public health sciences, and then of course nursing and pharmacy students and medical students and EMIHOLA students, because we want to get lots of information. And the online survey can be completed by men and women. That's important. The focus groups, we're really looking at women participants for the focus groups, because even though the vaccine is indicated for males also, we're really, again, for the purposes of this study, trying to target the female Pacific Islander Filipino population within this certain age range. Okay? So that's kind of a breakdown of the time. And so, depending on your level of interest and your availability, maybe you can make, 3 of the 5 training sessions in person. You can look at the other ones online afterwards. Maybe you can facilitate one focus group, maybe you can't facilitate any. That's okay. Because we can still use your help with recruiting people to the focus groups, still help with the discussion part. My sense is that we'll probably try to set up a group discussion online something, because we know that not all student leaders are going to be able to make all of the sessions. So we'll figure out, you guys are going to tell us what's the best way to chat about all of these ideas and help to filter it. So, and we'll ask Bert to guide us in what's the right form to do all of that. But so there's a lot of other roles to help with, even if you're not able to be a focus group facilitator. And so that's really kind of, again, the main role and the time frame for the student leaders. And the other thing to clarify is, if you're an advisory board member, we actually do not want you to be a participant in a focus group, because we just kind of told you a lot of information here about HPV and the vaccine, and that would kind of skew our results. So, so that's one thing you do not need to do. You do not need to be a focus group participant because you're a community advisory board member, okay? Because you guys know plenty already, just from our discussion here, okay? All right, and then we kind of spoke about the pharmacy students' involvement, the special involvement in terms of with the vaccination administration and helping with the campaign and other things. Okay, so the next thing, if no other questions, then we'll just go on. We touched a little bit already about the role of the Community Advisory Board. I wanted to go a little bit more in depth and actually hear from you folks. So, like Angela mentioned, you guys, the student leaders, are the community, and we have other important partners from the community: Department of Health, Hawaii Immunization Coalition. We also have faculty from multiple schools and disciplines here as part of our advisory board to guide us through the process, make sure we're staying on track. The research team, so the core research team is me, Carolyn, Angela, Brenda. So the 4 of us, and so our names are on the investigator list on that. So your job as the board is to make sure we're kind of doing our job, and that we're communicating with you and making sure you understand, making sure that we're answering any questions and clarifying any questions that you have, and making sure that whatever information is collected, that we're using it responsibly. And a lot of times when researchers work with communities of color for communities that face certain hardships and challenges. Historically, the researchers just kind of do their thing and leave. The community gets zero benefit. And we definitely don't want to do that. So your job as the board is to kind of make sure we're being responsible to you folks and that are using the data, etc., for the intended purpose. Any questions about that? Okay. So, so Angela spoke about, again, and the student leaders' involvement in the design, implementation, and also evaluation of the outreach portion. And by evaluation, some of that is going to be through, this online survey, we're going to re-survey widely at the end of the project as a very general way to see if the outreach efforts have been successful, just to see if there's a general increase in knowledge among the general UH population. But the student leaders, so not only you guys, but the other student leaders, they'll also be asked some questions at the end of the project. In fact, the focus group participants will also be asked a couple of questions at the end of each focus group, just to see if, based on what they discussed at the focus group, did that change their mind or their, I will try to get the vaccine, or I intend to get the vaccine, just to see. So they're going to get a pre-survey that's going to ask those same questions, and then after the focus group, then we're going to ask them just a couple more questions, and then look at it, just before and after, just to see if the focus groups alone made a difference. Okay. And then for the student leaders, especially those who have really helped in the design part, we're going to be asking, again, some other questions, probably in a survey as well as a discussion group, but this time focus more on the interdisciplinary training. So how is it working, not just with pharmacy, and not just with medicine, and not just with nursing, but kind of working together, and so there'll be that other piece of the evaluation as well. Let's see, and then, like I mentioned before, throughout the Community Advisory Board meetings, we'll actually be sharing some parts of the data as the results become available. And then definitely at the last meeting, and perhaps maybe at the third one, it just kind of depends on the timing, we're gonna be presenting some information to you folks, and then talking a lot about dissemination plans. So, which kind of information and what kind of, because we want to be sure that the information that we learn gets out, but we also want to be very, say something not so good is learned, I don't know, but just say there's something, we don't want to present it in a way that would make that community or that population or whatever, that make them look bad, right? And so we want to, again, make sure that you folks are there helping to kind of guide us and say, well, okay, so this is the finding and we have to report it, but maybe we can phrase it this way, or maybe we can put it with these terms or this other context, so that that piece of information alone doesn't make this population look bad or something like that. So that's, again, a very important role of the Community Advisory Board. Okay, and then also next steps. And so that's kind of what we're hoping you folks will help us with. But now we just want to see any comments from you folks in terms of your expectations, what you think of so far, anything else we missed, stuff like that. So now I'm stopping talking, so now you guys can.
What's the payment for the HPV vaccines? Are you guys getting, is that part of the cost or?
Okay, that's a good question. So the question was about the cost, how we're getting the very good cost. So the HPV vaccine is actually really expensive. And if the students have insurance, whether through their parents or UH student health insurance or other kind of insurance, then it should be covered. We did allocate some budget to purchase vaccine doses, and I think we have enough for maybe 95 doses. So it's not as much as we wanted, but the budget got slashed by a third, so we were able to keep in 95 doses. There is also a patient assistance program through the maker of the vaccine, and so if a person is eligible and interested, then we will be working with them, the student health services staff, pharmacy students, others, whoever will, we'll make sure that there's enough folks to kind of get that information to help learn or to help work with the student to fill out that form, basically. Because there is a form to fill out, and then the vaccine company will basically cover. So then what will happen is the student could get that shot that day, and then the student health services would be reimbursed later for that vaccine dose. So hopefully, we're trying to reduce that cost of the vaccine as a barrier, and we know that that's actually probably one of the biggest barriers to it, because like the hepatitis B, those of you in health professions program, the hepatitis B vaccine 3 series costs $210, and HPV is about the same. So it's really expensive. And so we've tried to work with the patient assistance programs and then have a little bit of money in the budget to buy vaccine if the student doesn't have any other way to get it funded.
Can you clarify for the 9 doses? So it's given in 3 doses.
3 doses.
So you're talking about to cover 90 people, or?
No, just 95 shots to cover 30 people. So, and depending on the timing, because the study's only going to go through, July, but essentially because it's timed with the academic calendar, most of the student interaction and the health fairs and all that stuff would be completed, in April. And so it may be that 95 students could get doses because it might just be that first dose, and then what would happen for the subsequent dose then is work with the student health services to get the patient assistance program dose for subsequent ones.
And all vaccines will be received at the student services.
The health fairs and or student services, correct? Yeah. Because it may be that the health fair, maybe the student health services doesn't have enough space, right? And so maybe they're going to have it at the center of campus or wherever the health fairs are usually held on the various campuses. But it would still be done in conjunction, and all the tracking and all that usual stuff would fall under student health services. So that's all their usual. Like if anybody were interested in getting any vaccine, that same process would be employed at the health fairs, even if it's not given on site at student health services.
Are you looking at who go back and get the second shot?
Yes.
So then tracking that would be the student services.
Exactly. So student services would help track that, we, in the process for those students who would be interested in getting the shot, we actually, because we're going to have their name and information, we actually are going to have their email as well, and ask if they're willing to get their cell phone, because then they could also get text reminders, like, oh, it's time for your second shot, make an appointment, stuff like that. So again, trying to use the media and method of communication. We were just discussing at our core meeting yesterday, it's like, do everything on the phone, if you have a smartphone. And so why not utilize that?
One of the things that I think is important to understand is what the students and we're supposed to expect out of this.
Sure.
And so that question actually pushes an envelope.
Sure.
One is, when you have a study like this, one of the things a study might do is give you enough knowledge to know that something is good. It's like weight loss or quitting tobacco. But actually doing it is a whole different thing. So it might actually turn out that you have a lot of good ideas for the media that, oh, great idea, but actually that translating into someone getting a first or second dose, like Lee said, there's a lot of barriers. So I think the expectation is really, I think, one of building a message system that you can actually say at the very least, well, I don't know if the very least, that it initiates a stage of change in your mind that you think, oh, this is a good idea, or that the people you're working with. It might not actually initiate the behaviors like weight loss. It takes a diet, it takes time, or it's quitting tobacco, right? So I think to separate that out, because I think if everybody goes in with the idea, oh, it's gonna then, everybody's gonna get the vaccine, that's not
I mean, one of the goals is to increase the vaccination rate by 25%. So we are hoping for a small change, recognizing that there are a lot of barriers to get the vaccination, but also because of the time frame of the study, we knew that we wouldn't be able to fully track all 3 doses because it's, it would take 7 months to track all 3 doses. But what we're hoping, and in terms of the evaluation and the tracking piece, so I mentioned other parts of the evaluation in terms of the change in knowledge and behavior and other stuff. But we do have in there, again, the questions about intent to get the vaccine, which is one step. But through Student Health Services is one way. And we were thinking about asking the students who signed up to be participants, just even sending them a text message, did you, so not only a reminder, but did you actually go, to get your 2nd shot, or did you go to get your 3rd shot? Now, there may be students who are not honest with their answers, and there's always, it's not going to be as precise as getting the information directly from Student Health Services. We also know that, at least here in Manoa, a lot of the students still have their own doctors in Honolulu outside of it. And so we know that Student Health Services may not be the usual source of care. We actually have a question in the survey asking the students, where do you usually get your health care? At your own doctor's office, or at a clinic, or community health center, Student Health Services, just so that we can help sort that out. So, but we are making every attempt to track that information. And again, the part of the nice thing about this study, and with the use of the mobile technology and the media is, again, maybe there might be, and the student leaders may come up with some other ways to help get that information besides just us sending a text message out. Did you get your 2nd shot? And then they say yes or no, or thinking about it, or no way, whatever it is. You guys may think of some other way cooler way to do that. There's a simple text message. I don't know. All I know is text messaging. But yeah, but we are trying to track that.
So, I guess, Neil, you bring up a good point, because if you're going to design a social media campaign, you should really understand what the objectives are, right? So is the objective really to inform, or to drive people toward getting the vaccine? So if we all understand what that objective is, then we can sort of design the proper messaging. The other thing about this text messaging, is this text messaging a system that's in place, or are you talking about somebody personally texting somebody?
Yeah, right now we don't have a system in place. So, but the research database can, I think, actually it's not as autopilot, yeah?
Well, yeah.
We were hoping that it was autopilot, but that's the advantage of perhaps using some other site or engine on the internet, maybe that could push messaging out, multiple types of messaging out.
Possibly. So just, you got to think about how you want to facilitate that action of texting somebody.
Mm-hmm.
There may be some systems out there that we could leverage. The other thing the participants need to understand is that, this is all private, right? So people might get a text and they might be asking, did you get your vaccine? And who am I talking to?
Right. Exactly. Good points. Any other comments, questions?
Go ahead.
So I was just wondering, so for the first surveys, is there an expected number did you guys want to get? And also for the focus groups, how many students were you guys looking for?
Okay, great question. So at a minimum, we wanted to get 100 response for the online survey. We wanted to get a minimum of 100 responses from the Manoa campus and 50 responses from Hilo. Based on preliminary discussions, we are very hopeful that we'll get way more than that. So, but the 150 was kind of the minimum number to be meaningful. And then for the focus groups, there's going to be 6 focus groups on the Manoa campus, 6 focus groups on the Hilo campus. We're really targeting about 8 people per focus group, maybe 10 at the max, but really trying to keep it so that it's small enough so they can really have time to explore, thoughts and ideas and stuff like that. So, so that's how many. And so we do have a website, and we'll send you, actually the website link is on the bottom of this, the last page of this 4-page thing. uhhpv.wordpress.com, and that website actually has a lot of information. I would encourage the student leaders to look at it, but not tell your friends yet, right? Because we want to first get the survey done without saying, oh, look at our website has all this information. Okay, so you guys as student leaders, certainly please look at the website, but don't tell your friends yet. Once the online surveys are done, once the focus groups are done, we will make that URL known much more widely. But on the contact us page, there is a button, a link. If they're interested in participating, then it'll take them to another site, another form, basically, where they would, put in their contact information. So that one, we are collecting names, but it's just an interest form. Names, emails, are you male, female, what ethnicity, what class, freshman, sophomore, junior, senior, graduate student, and what they're interested in. And on that contact page of the website, we do have some information about the time commitment, so that they can have some of that information already, just to decide, and the options are, I'm interested in participating in a focus group, or a discussion group is how I phrased it. I'm interested in being a student leader, and I don't have time for either, but I'm still interested, so keep me informed. And so we have those three options for the students, just to kind of help us collect information. But of course, they don't always have to use the form. They could also contact us. We have a project email that they can also just send that information to as well.
One other thing I'm wondering about is, so there's going to be a Filipino group and there's going to be a specific island group. So is this project expected to handle the cultural nuances? Like I would say in the Pacific Island group, there's going to be Hawaiians, Samoans, Tongans, Marshallese, Chukis, maybe a Solomon Islander or two. And so I would think the response to different messages and the creation is different. Mm-hmm. And so from Bert's standpoint, or from what they're supposed to create, what is it like? Just send out the talofa and the aloha, or are you going to really nuance it, or is it really expected to be the Pacific Island group supposed to come up with a generic Pacific Island message?
I think our expectation is that the students are going to decide what they need to do, and that there will be multiple messages. Because that's why we're trying to recruit student leaders from many different Pacific Islander ethnicities, as well as Filipinos. And then the other focus group, again, we have 6 focus groups slated. Filipino, ideally in the ideal world, vaccinated Filipinos, unvaccinated Filipinos, vaccinated Pacific Islander, mixed Pacific Islander, because there's lots of Pacific Islanders, unvaccinated, and then the other set was supposed to be more mixed. But if, depending on the interest, it's entirely possible to further break out whether it's, because maybe, there's, Tagalog and Ilocano, there's a lot of different Filipinos as well, and there's a lot of different Pacific Islanders. So, so it may be possible to break it out. For the design of this study, and Angela, please correct me if I'm saying anything wrong, the focus group information was really meant to just give the student leaders information. So in terms of the numbers and types and breaking it out, and from that statistics point of view, it's not designed to do it exactly.
Yeah, it's meant for more formative research to help in the development of the material. So I do agree with you that, maybe there are nuances, and so how are we going to agree on a message? But I guess we gotta kind of start somewhere, and at least they're there, and hopefully maybe they'll come up with something they agree. But maybe if the different groups there say, no, we just really have to keep the messages separate, then maybe keep it separate. I don't know.
And that's where, again, the student leaders will tell us, what works. And so, say for the Marshallese students, if they say, no, your network, your friends, whoever, like this one doesn't work for us, and we want to do this, or we want a message in language, maybe, or whatever it is, that's, it's fine. We just have to make sure that as we're designing it, that we're able to, so say a message is given in a language other than English, we're going to rely on the student leaders to make sure that that message is accurate, right, in terms of written, and, that may, who knows how that's going to work. But even if the messages are different, ultimately, we need to make sure that it's pointing them all to the same kind of information page, directing them towards a health fair or an event, and encouraging them to get vaccination. So even though the how it's delivered and what kind of interesting points are put in the message or whatever, that may be completely different. And we may have multiple outreach messages, you know, that go out. So again, it's a pilot study, so we didn't control for absolutely everything because we don't know. This is the first time this type of research is being done in these populations, so we just wanted to start somewhere. Any other questions?
Participants sign up. Are they gonna self-select which sort of group they are in? And I guess to your point, you know, like if they're from the Marshall Islands or Tongans or Samoans, can they self-select so we kind of know? Like if the majority is from Marshallese, then you know we can sort of craft up.
Right.
Yeah.
Right. So on the student participant form, we have 30, 25 ethnicities listed. And it's the same grouping of ethnicities as on the big long survey. So whether they're doing the student interest form or filling out the thing after the focus group, we have all that same kind of ethnic breakdown.
And are your surveys all online?
Yes.
Okay, good.
Yeah,
So
they're
they
online.
all feed into like a spreadsheet or something?
Correct. They feed into a database, the research database here at the middle school.
Can I just ask the students, I mean, after hearing sort of the various areas of involvement, does it seem like it's a lot? To attend the 5 sessions from a timing standpoint to, you know, the interest of facilitating a focus group, is that something that, you know, can you share any thoughts? We obviously want you to to be involved and not feel overwhelmed at this and just say, oh, I just can't do it. We just, you know, whatever degree you want to be in, you know, some thoughts about, is leading a focus group seem very intimidating or not, or?
Okay.
So, just as a suggestion, I mean, if you want to continue this conversation, you know, with all of us, we could do either a Facebook group, which is private, we could just, you know, but we have to all join Facebook, or we could do it on Google Plus community. And personally, I prefer Google Plus, because that, you know, can get fed into your email and, you know, sort of can keep track, and then there's a whole threaded conversation and all that. But the expectation is that people participate and sign up now. I mean, you know, so we can all start having conversation on there. So if you guys want to do that, I mean, you can certainly set it up.
And email is Google. I mean, email is Google. It's Google based.
Right,
But
you still
not the Google Plus part.
probably need
Yeah.
to get a Gmail account.
Yeah. So you would still need your own personal Gmail. You know, and if it feeds into your Hawaii.edu, that's totally up to you. Okay, so what we'll need, so on this side in the, on the sign-in sheet, we asked you for your email, but maybe if you do have a Gmail account, if you can just kind of add your Gmail account to this form. And then on the Hilo side, could someone just send a sheet of paper? What we're asking for is, you know, first name, last name, kind of profession, you know, are you undergraduate student, graduate student, what, you know, that kind of stuff. But then also your email. So just give us the one that you check the most. And then, but also your Gmail account, if you have one, because we'll need that for the Google Plus. Yeah, okay, thank you. Okay,
Yeah, just one last comment for many of the students who are thinking about participating. One thing about this project is that it's a real project, meaning that you are, I believe, on the cutting edge of science and technology to really prevent cervical cancer in women of your ethnicities in ways that's not been done before. So this is not like going down to the pond and counting how many ducks go in and out of the pond. And you know, it's really real science that can have a potential huge impact. And it's not so it's a science project, as it were, but I think this has true application, and especially for women, to prevent a very serious disease. And so, you know, just a pitch to say, as you're deciphering what's important and not, I personally think this is important, but, you know, just FYI.
So what we have on the calendar are the classes, and then we have the week of the 17th and the 24th. We have, again, just tentative focus group sessions. These have not been scheduled at all. We do need to know, at least from this group, who is so check your calendars, and if you're interested in being a facilitator. So again, to be a facilitator of a focus group, you do need to participate in one of Angela's training, the class 1, either on the 7th or the 11th. And so if you are interested and available to do that training, and also available to do at least one focus group, if you could please check your calendar to let us know what times might be good for you, because we're gonna kind of have to schedule the focus groups around the facilitators' availability, you know, and it doesn't make, I mean, we set these 3 days hoping, you know, that sometime in those days, but we're gonna, you know, need to look for rooms and logistics and all those other kinds of things. So if you are interested in being a facilitator, please take a look at these dates, 17, 18, 19, 24, 25th, 26th, and let us know, you know, what your availability is on any of those 6 dates, and then we'll try to figure it out and juggle. Okay. And then if you turn to March, we have the Bert's class, the one on the 6th, and then on the 17th, I'm waiting to hear back from Dr. Nichols if there is actually going to be a health fair here, because there's a condom fair coming up on Valentine's Day for the Manoa campus, and so I'm not sure if they're planning to do something else in March or April. So I asked him that question specifically today, and then we'll need to find out from UH Student Health Services also if there's any kind of health fair or outreach campaign already planned, because, you know, then it would make sense to just piggyback. Okay. And so for the next advisory board meeting, we were thinking that it might be that week before spring break. I know it says number 3, but it's actually number 2. And so the question, again, just to kind of think about is, we know it's right before spring break and testing and all of that kind of stuff. I don't know, you know, if that's the best time. But the hope for the second advisory board meeting was to, again, maybe get some preliminary information back, because by then we'll have focus groups done, hopefully, and we'll have the survey done. And so at least with the end, we'll have had some of most of the student leader meetings completed. And so, again, that advisory board meeting, we would kind of look at some of that preliminary information and talk about it and say, okay, well, kind of what are the next steps, you know, and what are we learning? Are we heading the, you know, the right direction? What kind of barriers are we encountering? Stuff like that. So that's the proposed for the second advisory board meeting. It would just be 1 day, but Thursdays and Fridays tend to work better for some of us. So. But if it totally doesn't work for you guys, then you know, obviously you have to adjust schedules. Okay, and then actually this calendar doesn't have the proposed 3rd and 4th advisory board meetings, but I think what I was thinking was the 3rd one might happen sometime in April after the health fairs. Again, kind of more to see where we are. And I think I was thinking towards the end of April, like that last week of April. We basically wanted to do nothing with the students. Not that we don't like you, but, you know, knowing that May is like crazy, you know, because of finals and other things. So we really didn't want to have activities that would involve the student leaders, you know, in May, or at least in that first 2 weeks of May, because that would be really rude of us. And so it does have here tentative student leaders meeting and stuff, but that'll get pushed back. So again, so for the 3rd meeting of the advisory board, thinking maybe end of April, and again, because we want the students' participation. We know that some of you may not be on campus, you know, after May. There will be a 4th advisory board meeting sometime in June. Again, kind of the wrap up, and here's some of the data and the dissemination discussion. But you guys will need to let us know If you're not gonna be available at all in June, then we need to know that, and then we'll adjust the schedule. So probably what we'll do is Mavis will send out an email to all of us here at this meeting today, and just kind of checking your, what are better times for the advisory board meeting. So thank you for reminding us. So on the uhhpvwordpress.com site, we're gonna make a private section and with the same username and password, probably something like student leaders and some generic, but it's gonna be private basically, and we will email you that information, and then all the videos, the minutes from these meetings, all of that stuff will be posted on that private section of the website. All right, thank you everybody. Give yourselves a hand.